Okay.
Hello, my name is Alex Boy. This is a poster here presenting on interferon-free therapy for LVAD patients with end-stage liver failure and new hope for heart transplantation. So several studies have found that there's an increased Hep C virus antibody prevalence in patients with cardiomyopathy. Chronic Hep C is an exclusion criteria at certain heart transplant centers. And so what we were interested in is if we can treat patients with Hep C, would that increase eligibility for heart transplantation? Starting in January 2014, patients with LVADs and chronic Hep C at Washington Hospital Center were started on all oral therapy for hepatitis C. We had 3 patients on Alisio, 1 patient on Harvoni. All patients received 12 weeks of therapy per guidelines, and safety labs and other labs were drawn at 4, 12 weeks of therapy, and then at 4, 12, and 24 weeks post-treatment. Patient characteristics, as I said, there's only 4 patients that we treated. Median age 64, 50% men, 50% women. They were all Black African American, and the insurance primarily was Medicare, public insurance. 1 patient was privately insured. As I mentioned, all 4 patients successfully completed therapy. 3 finished Simsoft, 1 Harvoni. Men and women equally represented, as I mentioned. Patient 1 at SVR 24, considered cured, did receive a heart transplant in late January, and 4 weeks post-treatment was still undetectable. Patients 2 and 3 have been considered cured and are awaiting transplantation, have not yet been transplanted. Patient 4 had a viral breakthrough. Patient 4 was also on Harvoni, had a viral breakthrough at end of treatment, but was then undetectable at post-treatment week 4. Unfortunately, he was hospitalized 1 week for influenza, 1 week after week 4 post-treatment. He was hospitalized for influenza and elevated INR, and though he claimed to only have missed 1 dose of Harvoni, he subsequently died 4 weeks later, and we're awaiting the medical report on that patient.
Please, can you go over your conclusions?
Yes, so in this, again, this is a very small group of LVAD patients who are also chronically infected with Hep C. Therapy was provided safely and is tolerable and likely efficacious. The new FDA warning has been issued for the risk of significant bradycardia with the use of amiodarone and sofosbuvir-based regimens. Though no statistical conclusions can be drawn, patients who were previously ineligible to receive heart transplantations now have the hope of going beyond destination LVADs and being transplanted. And perhaps HCV will no longer be an exclusion criteria at heart transplant centers around the country.
Thank you very much for your time.